In Roswell, New Mexico, it's not just about UFOs. This community has a new mission, bringing more doctors home. See how an entire town is working together to build a healthier future. She grew up dreaming of wearing a white coat. Now student physician Kathryne Byrne is turning that dream into reality. Hear her powerful story of why she wanted to become a doctor. From cancer studies to cutting-edge technology, medical students are leading the way to discovery. See how our future physicians are making an impact at Student Research Day. What does it take to keep healthcare strong in rural New Mexico? We sit down with the CEO of Eastern New Mexico Medical Center for an inside look at the challenges and solutions. That's coming up. All that and much more. So let's get started. Hey everybody, welcome to the DO Pulse, a podcast about osteopathic medicine, community, and education. I'm your host, Sidney Alvarez. Now this podcast is brought to you by Burrell College of Osteopathic Medicine and sponsored by GCU. Go to gcu.com for all your financial needs. Now the mission here at Burrell College is to help underserved communities with their medical needs. And one way that we do this is by partnering with different stakeholders. Now here's a story that's out of this world that shows you how we're all working together.
Roswell, New Mexico is world famous for UFOs, aliens, and a touch of mystery. But behind the tourism, there's another mission underway, bringing doctors back home to serve this rural community. That's where students like Latricia Velasquez from Burrell College of Osteopathic Medicine come in. She's from Roswell, and she's going to be a doctor.
That's primarily why I'm really interested in primary care. Is just to be able to really spread that awareness to everybody in the community.
Velasquez is a recipient of the Peyton Yates Scholarship, which covers her tuition at Burrell.
We have to invest in education, healthcare, community development, the arts. So all of those components really make up a healthy community.
City leaders say the program is helping fight a nationwide challenge, keeping doctors in smaller communities.
When you look about healthcare and people who want to have a career in healthcare, Roswell is a perfect place to be.
Roswell may be known for its flying saucers or out-of-this-world stories, but community members here also focus on something very grounded. They want to make sure that the residents here have health care for years to come.
Both of Roswell's hospitals are teaming up with Burrell College to host clinical rotations and help students see what life and medicine in Roswell can offer.
If we recruit 1 to 2 of those physicians per year, it can have a monumental impact, positive impact for our southeast New Mexico.
We're 2.5 hours to any major metropolitan area, and we provide a lifeline to this community and the surrounding communities.
Burrell College helps coordinate those rotations.
All of our partnering facilities really treat them as potential employees for later on down the road.
And as for Latricia, the impact is personal.
It really just sends me over the moon to be able to receive this scholarship, and yes, that pun was intended.
Definitely over the moon. Now here at Burrell, research is also at the top of our academic list. And recently we had 2 back-to-back student research days, first in Florida and then here in New Mexico. Watch this story.
We're celebrating our student research achievements for our first annual Medical Student Research Day in Melbourne, Florida, on our Melbourne campus. And we're having a chance to hear from our students who have done a lot of research over the last year, worked on individual cases, done some surveys, other scholarly activity, and we're celebrating their achievements and their work from the last year.
Our project is on skin cancer education and community health care workers. Community health workers are public health workers that are not medically trained, but they provide support in clinical activities such as diagnosis and treatment. We provided a pre-quiz, post-quiz, and educational flyer on the ABCDEs of melanoma.
I'm working alongside FIT on a project entitled Unveiling Complications of Subretinal Injections, and what we're pretty much doing is trying to correlate flow rate to RPE damage in the subretinal layer. This is very important for things like gene and stem cell therapies of the future?
Yeah, so the students have been great. A lot of the students who are presenting today are students who did research over the last summer, and it's been an intensive summer research experience program. But we have students from our 3rd and 4th year rotation sites here, and students who did virtual research with some faculty spread across the country. And so we're bringing them all together here to talk about their exciting achievements.
We're studying the effects of OMT on migraines, and our goal is to identify for billions of people around the world who suffer from migraines an alternative to migraine treatment other than medications or more expensive treatments.
They were able to really present why they're doing the research that they're doing, how it's important clinically and to the broader community, and what next steps might be. They were really able to show and talk about the limitations of maybe the research that they did, the strengths, and what they hope to find and participate in the future.
Today we're celebrating our student research successes here in Las Cruces for our 8th annual Medical Student Research Day. We're also partnering with the New Mexico Osteopathic Medical Association and their Chile Symposium to provide a joint program that really highlights all of the exciting osteopathic medicine and the research activities that are going on around here.
Well, our poster and our studies mostly focus on a specific protein called TIF1 alpha that is commonly overexpressed in cells that are under low oxygen conditions. And this is really important because of many diseases that have been caused because of hypoxia, like cancer. This could really help target what part of the pathway we can really decrease the amount of cancer cells in its growth.
We examined the rates of COVID vaccine acceptance or refusal amongst people who are living with HIV. What we really found is that amongst this population, there was nearly a 40% refusal and hesitancy rate, so they were mainly worried about flare-ups. So it's the same reasons that the general population is worried about, but it's a little bit higher, more fear over the concerns of the side effects, of the concerns of their medications and what's going to happen.
We had over 100 students in our summer research experience this last year. We have about 50 posters here. We had 5 oral presentations, and so this represents a culmination of work for a large proportion of our student body.
Our project is really focused on trying to better understand certain neuropsychiatric disorders. We looked at the amygdala in relation to stress to be able to determine which regions are stress sensitive and also which regions have more inhibition that's happening in the different subregions of the amygdala. If we can better understand this, we can also come up with new therapies and new therapeutics in the future to be able to better treat these neuropsychiatric conditions.
We're also happy to celebrate the winners of our poster presentation. We have 3 winners, winning projects from our poster presentations, as well as we have a winning oral presentation. So we're really excited to celebrate those excellent projects.
It's time for our first break. She grew up dreaming of wearing a white coat. Now student physician Kathryne Byrne is turning that dream into reality. Hear her powerful story of why she wanted to become a doctor. What does it take to keep healthcare strong in rural New Mexico? We sit down with the CEO of Eastern New Mexico Medical Center for an inside look at the challenges and solutions. That's coming up.
You will grow. Your patience and care will pay off. Sure, you can get some help along the way, but you will do it. You will do it all, and we'll be with you to make it happen. Open a GECU savings account online now.
I didn't grow up seeing people like me in medicine, but even then, I believed there had to be a place for me, a place where someone like me could say, "You belong." I'm a first-generation student, the first in my family to graduate high school, the first to go to college, and now the first to become a doctor. At Burrell College, I found more than just an education. I found people who believed in me. I found purpose. At Burrell College, you belong.
Hey everybody, welcome back. Today we are in Roswell, New Mexico, and I'm joined by the CEO of Eastern Mexico Medical Center, Warren Yell.
Yep. Good morning.
Thank you. Thank you for being on the show.
I'm excited.
So, you and your organization have been a long-standing partner with Burrell College. Tell me about this.
Yeah, sure. The journey started in the early 2010s. I was here as a chief operating officer, and what was really exciting then, it was all just paper. It was conceptual, it was a knowledge. I don't even think dirt had been moved yet. And so we were one of the first sites to sign off as being one of the clinical rotation sites, and we were very passionate about this. The future for us, the way we saw it, is we needed a pipeline of physicians, right? That's one of the hardest challenging things is recruiting a rural market. And so in my journey, both here as the Chief Operating Officer and now as a CEO, as I had the opportunity to both be part of the initial signature, the initial conceptual idea, be there for the ribbon cutting and breaking ground for Burrell, and now 5-6 years later, really being part of those clinical rotations. And it's been an amazing evolution, and really being there from day one through now has been an incredible journey.
And and those rotations are absolutely important to our students. Tell me about the rotations and the knowledge that they're gaining here with your hospital.
Sure. So the big challenge is how do you go from the didactic to the practice of medicine, right? And like many things, the only way to truly learn it is to do it. And so the great thing is we have an incredible group of attending physicians here in our community who really leaned into the education. I believe in healthcare, a lot of people go back to the roots. Every single one of us was trained by somebody. We had a mentor, we had somebody who showed us the way. And so by doing these clinical rotations, our physicians have the ability to impart their knowledge on the next generation of Burrell students. We then have the ability to really help sell the community as well during these rotations. They really get a flavor of what does it mean to work in Roswell? What is the medical community like? And really the long-term goal is to lead to hopefully future doctors for New Mexico. We've had 2 success stories so far. We're incredibly proud of that. We have both Dr. Futaneri and Dr. Trevor Miller who joined us, and they've done incredible. And so from that perspective, the other thing I always look at with these clinical rotations is we're a better hospital when we're a teaching institution. Not that all hospitals aren't and non-teaching units aren't, but I believe we take it a little bit more serious. Education is incredibly important. We want to do it right. And in addition to that, the students bring the latest and greatest research. There may be things, medicine changes by the day sometimes. And so they may have information that we haven't heard or seen yet, and they can help us do research, deploy it, bring it forward, and then oftentimes make us a better institution at the end of the day as well.
Warren, tell me about your hospital and tell me a little bit about the people that you serve.
Sure. So Eastern New Mexico Medical Center is 162 licensed beds. We have a 23-bed ER. We're a trauma center, stroke center, and chest pain center.
Wow.
And really do provide comprehensive care for Southeast New Mexico. We're one of the largest hospitals of the 11 and in Southeast New Mexico, and we're very, very proud of the care that we provide here. It very much is your friends, families, and neighbors that kind of provide care. We're a smaller community, and we're 3 hours from all the level 1 centers, tertiary centers. And so oftentimes we're the center of gravity for healthcare in Southeast New Mexico. And so we're very proud of the care we provide here day in, day out, and we're just excited to kind of continue to develop and grow. We've made significant investments in technology the last several years with a new EMR, as well as a brand new surgical robotic system that just started here in July. So it's awesome. Great community-based hospital, regional center for Southeast New Mexico, but we're still bringing that modern technology and modern medical care to the area.
Yes. Warren, you mentioned 2 of our alumni that are now here in the Roswell community practicing. What's it like to see that come full circle, where they came here as students and now they're practicing?
Yeah, it's incredible. I always tell people when we bring those Burrell students, when our physicians come in, I was like, that's our future medical staff. It may be 6-7 years from now, but they're coming back. And so really to have them come back, one, they're invested, they know the community, the attendings here, they already have relationships, and then oftentimes they may have already started developing different physician and or patient relationships when they were here as a student.
Yes.
And so it's honestly the success. It's incredible. We are incredibly proud of both physicians coming on board, and they've honestly been great integrations in the network. You're not selling the community now. Now they can really focus on, I don't have to learn Roswell, I just need to learn how do I practice, how do I become that attending and do that next step.
Very, very important. I also want to bring up preceptors. I know that your hospital is also part of our preceptor program, your doctors here. Tell me a little bit about why that's so important, that hands-on training.
What's really interesting to me is like we don't mandate for any of our medical staff. Our medical staff is volunteering and often engaging of their own volition to kind of get involved with these students, which I think is exciting. At the end of the day, if the CEO comes down and the suit comes down and says, oh, you're getting a student and they're not passionate about it, it's not right for the student.
Right.
But every single one of our providers and our physicians leans into that. It's their choice and they're passionate about the education component of what they do. And so from that perspective, we have the subspecialists that some of the markets may not have, interventional cardiology, GI, general surgery, just everybody kind of coming together and trying to ensure that we provide that comprehensive training for them. And the great thing is we work very closely with all of Southeast New Mexico. And so as they work within the region, they also help build some bridges between attendings that may not know each other as well, but with those student rotations, they're able to kind of say, hey, did you know that in Roswell they're doing this, or in Lovington they're doing this, or in Artesia they're doing this? And it helps us really provide that kind of comprehensive network, if you will.
Warren, I'd like you to look at that camera, and I want you to tell or say to our Burrell students why they should come to your particular facility. Tell them why they should come here.
Sure. Southeast New Mexico is just the best, so that we'll just start there and work backwards. Honestly, the relationship you'll develop with the attendees here, and I think any relationship in any market is going to be important, but in Roswell, you may be a student of 1 or 2, and so for that, you have a lot more of a direct relationship with your preceptor and the students. I think the second thing you have here is there's just such a medical need in our community that you have the ability to build connections and get involved in ways that you wouldn't necessarily be able to in a bigger market. And so it really is, that could be community education, it could be working with our school systems, it could be working with our providers on specialty clinics or projects, it could be research. Really, all of those things are open to you, even though you're more in a rural market, and that may be a little scary if you've never lived or worked in it, but you really get more of that hands-on front end hyper exposure to the patient and the patient care here, because that's what our doctors do day in, day out. They are often the only service line in many of those capacities, and they may be servicing 250,000 people in a 180-mile radius. That is a little bit more unique when you may live in a bigger urban center where people are kind of coming to you on a regular basis.
Warren, if people want more information on Eastern New Mexico Medical Center, where do they go?
Sure. Our website's always a classic. I highly recommend you check out our Facebook. That's probably the most up-to-date information. We're very active on LinkedIn. And so any of those different articles or ways to get involved, I think, are there. And then, of course, my personal information, we'll make sure that's kind of shared as needed, but I'm always a phone call away if you have any questions.
Perfect. Warren, thank you so much for the information and taking the time to speak with us. We really appreciate it.
My pleasure. Thank you.
We'll be right back. She grew up dreaming of wearing a white coat. Now student physician Kathryne Byrne is turning that dream into reality. Hear her powerful story of why she wanted to become a doctor.
I became a doctor because I wanted to do more for my family, for my community, for the people living in places where healthcare is hard to find. My parents built a life from the ground up. They taught me what hard work and sacrifice really mean. At Burrell College, I found more than just a medical education. I found purpose. Hands-on training, mentors who believed in me, and the chance to serve the communities that shaped me.
Dr. Grant.
Thank you so much.
Congratulations.
Thank you so much. Today, I'm an emergency medicine physician, right where I always wanted to be, on the front lines in my community, helping those who need it most. At Burrell College, you belong.
Hey everybody, welcome back. We're here at the Melbourne campus in Florida, and I'm joined by a very special guest, second-year student physician Kathryne Byrne. Thank you for being on the show.
Of course, thank you for having me.
So, I have to ask, you just finished the first year, you're about to enter your second year. How'd it go? How's it going?
It's going good. I think first year was definitely a shock of how much information we were actually getting. You know, they say that it really feels like you're drinking from a fire hose. And it's very true. But now going into second year, I feel like I have a much clearer head on how I want to approach my studies, how I want to balance, just have that balance of life and school. So I'm excited to start the new year.
Well, you know, that's very important. I'm glad you brought that up because you do have to find that balance between
between your studies and your education and your well-being. Tell me about that.
Yes, so for the first year, I think my mistake was truly making school the center of my life. It really became everything I spoke about, everything I thought of, and I found that I wasn't moving my body as much, I wasn't eating as healthy, I definitely wasn't going to the gym like I had planned, but I realized that the weeks that I would take some time for myself, I would perform better. So I want to bring that going into second year and just make a better schedule and better balance.
All right, so Kathryne, let's talk about med school. You know, why did you want to become a doctor? Why did you want to pursue that path?
Looking back, I don't think my path was the traditional one. For the longest time, I didn't even think becoming a doctor was something for me. I don't have a family of doctors. So once I went to college and started taking science classes, I realized that I found an interest in learning about the human body, learning how to take care of yourself. And I found that with my passion of advocacy, mentorship, and just educating others. I found myself educating my family a lot on the things I was learning. I found that all together, I could find that in a career, and it was becoming a physician.
You know, when you were younger, and maybe when your family went to the doctor or when you went to the doctor, did you think to yourself, maybe this is something that I could do. Maybe this is something that is a calling to me. Did you ever get that sense?
I got it a lot when I would take my brother to the doctor. Sometimes my mom just wasn't available, so I would take him to the doctors, and I found an interest in pediatrics. And it wasn't until I got to shadow my family's pediatrician that I really saw myself in that field, and just learning more about it, I think I fell in love with it.
So tell me why. Is it the fact that you're able to help, you know, these children, you know, overcome their illnesses?
Yes, and I think on top of that too, the trust that these parents give to the physicians of bringing their kids and trusting that that doctor is going to care for them and guide them to be healthy adults, I think that itself is really rewarding.
You know, you shared with me prior to the interview that when you would go to the doctor and being able to communicate was very important, and communicate in a language that the patient understands, and building that trust. Tell me why that was so important to you.
I found that working as a CNA in Orlando, I was often the source to translate for a lot of the doctors and the nurses. So if they had a Portuguese-speaking patient or a Spanish-speaking patient, I was often the one helping to translate.
Yes.
And I found that them noticing that I share their language, they would start sharing more about their lifestyle, their concerns, things they were afraid of, and I felt like that connection and that trust you can really only get when you share the language.
I agree. They open up.
Yes,
they
do.
develop that confidence in you, and so you would, you know, you have that knowledge, you have that background. You want to apply it to when you physically become a doctor as well?
I do. I find that I want to work in underserved communities to try to provide these patients with just more accessible health care. And I think if they find that I can speak their language, they're going to be more willing to come, they're going to be more willing to seek help. And I want to be there for them in that sense.
Let's talk about Burrell. Is that okay? We're going to talk about Burrell now. Why'd you pick Burrell College to, you know, become a doctor, to get your training?
I really liked the mission. Just the fact that they are trying to diversify the workforce. Again, kind of going back to my experience as a CNA, just working with that population, I saw how important it is to have physicians who share the same language. So coming here, I knew that they would provide me with the best support to serve these patients.
Beautiful. I gotta have you share some words of advice to incoming students or people who are thinking about coming to med school. Can you look at your camera and share your advice? Let people know, you know, what worked for you. Go ahead.
So I'll say for those thinking of coming to medicine, the pediatrician that I shadowed, his simple motivation was, if I can do it, you can do it. And I really believe in that. If you have the passion to go to medical school and you're okay with the sacrifices you'll make along the way, I think anyone can do it. For incoming students, definitely find that balance. It's okay to take a break. It's okay to take time to go to the gym, make yourself a meal. I think finding that balance is what will help you succeed.
Kathryne, thank you so much. We truly appreciate your time, okay?
Thank you so much.
We'll be right back. Well, that's our show. Thank you for watching. If you got questions or concerns about the program or story ideas, please send us an email. Our email is communications@burrell.edu. We'd love to hear from you. You can also follow us on any of our social media platforms. Our handle is @Burrell College. I'm your host, Sidney Alvarez. Thanks for watching, and until next time.